Back now on Triad Today, always glad one of our good folks from UNCG can stop by, and she is in a new position. So we're going to talk about that position and what it means for a lot of kids in the area. Next to me, our good friend Mary Holderness, who is UNCG School of Nursing's health coordinator and educator for Moss Street Partnership School. Welcome.
Thank you.
Good to see you. And a nurse by trade.
Yes, in fact, I did my training at UNCG, both in
why
public
not?
health and UNCG.
Yeah, why
so
not?
yes,
Yeah.
it's nice to be back
So
home.
you're a real nurse then,
I'm a
right?
real
That's
nurse
right.
and back home.
Now, yours is a newly created position. I know you're excited about it, but let's give just a few seconds of background in case somebody hasn't seen some of our previous segments where we did talk about Moss Street School. What is Moss Street Partnership School all about, and then what is your position going to entail?
Well, Moss Street Partnership School is a school. It's run by the School of Education at UNCG. It is addressing some of the low performing schools, and it was started by grant, money by grant,
Right.
and so they are working to infuse that school with great education and help those children get caught up.
I know you're doing some background information and research and getting ready to start later this month, but I'm wondering, how does it feel to you to start on something like this during a COVID-19 pandemic, as it were?
How could I be so lucky? I mean, really, trying to meet people, staff, and other people, it's that barrier of social distancing, and getting to know the children, of course, will be delayed because they won't be actually coming in the building.
Right.
But it's like any other business. We all have to be creative and do it in a different way, and because that's what we do, and
Absolutely.
That's what nurses do. That's what school nurses do.
Nurses do everything. I just love nurses. And but if you're doing remote learning and all the challenges we're going to have, at least for 9 weeks or so, how's it going to be important for you to get health education information to parents and kids during this time?
Well, like the beginning of any school year anywhere, our first focus is to check for immunizations and health assessments to make sure that everybody's got current with what they need.
Right.
It's the North Carolina law, but it's also what we need to protect these children, and it's something we can do. We can't control a virus. We can't control who's wearing a mask, but that is something parents can do, and we can empower them to know where to go and the importance of that at this beginning time.
And of course, not only just to get a plug in for the School of Nursing, but in a practical sense, you're going to be involving nursing students in getting hands-on experience throughout the community. That's important too, right?
I already have had 4 fabulous nursing students join me that helped me assess all 300 records of the children.
Wow.
They did an outstanding job. It was a very tedious and daunting task, but that's the perk of this whole position, is the partnership and collaboration with the School of Nursing and having the students come, because they will see how a community affects children or any patient for that matter. When you're in a clinical setting and you give directives and medication, you really don't know what happens when
Right.
they go home. You don't know what their community and culture, how that and their family influences their lifestyle and their following that healthcare plan.
Good
And
experience
so,
for the
yes.
nursing students,
Yes.
beneficial to the kids. It's just
Yes.
great. I want to put up on screen the general website, the UNCG, so
Yes.
you can follow what's going on around campus as well, uncg.edu. I have about 10 seconds left, and we'll put you on the spot and ask you who or what led you to a career in nursing. 10 seconds.
Oh, in 10 seconds? Oh, I don't know. My grandmother was a nurse. So,
Okay.
I was always around that, and
Good role model.
had that role model and that experience. And she worked in a city, and she also worked in a rural area, so I've done the same things she has.
Isn't that great? Well, I'm glad
Yeah.
you're doing it.
Thank you.
Thanks for being here.
It's a privilege.
All
Thank
right.
you.
We'll be right back after this.